Sounds good.
All right. All right. Well, Dr. Rob Kiltz, welcoming Dr. Shawn Baker, someone I've been following for a long time in the carnivore space, and one of the first carnivore books that I've read, and been on this journey also in the world of health and wellness. So welcome, Shawn. How are you doing today?
I am doing nice. I'm doing well. I'm usually pretty good. I'm generally a pretty happy and generally happy person. Life is good.
I can see that. That's what's such inspiring about what you're doing. Why don't you tell us a little bit about yourself, where you hailing from, and what got you into this crazy space?
Yeah, it's kind of weird. I mean, if you had asked me 10 years ago, if you would have predicted where I was going to be, there's no way in hell I'd have said I'm some crazy carnivore doctor, doing all the stuff I'm doing these days. But life is very unpredictable. So I'm classically trained as an orthopedic surgeon. I did kind of the standard. I actually wasn't really that standard. I started in medical school back in the 1980s and and I ended up leaving to go play professional rugby. So I left to go to New Zealand right after my first year in medical school. And then I did that, floated around and joined the military, launched nuclear bombs. Decided when I was about 30, when I got tired of getting kicked in the head too much, maybe that's what's wrong with me. On the rugby trip, I went back to medical school, got into orthopedics and then did that. And then I was a military guy. The military paid for that. And so I ended up doing some military time, did a little bit of time deployed over in, trauma zones like Afghanistan. Went into I was employed, but basically private practice type of situation, headed a group and did that for quite a while. And then I started to really start to look, really what caused me to is my own health was starting to suffer a little bit. And I think really most physicians don't think about it until it affects them personally. It's kind of sad to think about it, but that's really the impetus for most of us. And so as I got into my mid 40s, I started to see, hey man, I'm not, feeling as good. I'm not sleeping well. My blood pressure's up a little bit. I'm probably pre-diabetic and metabolic syndrome and all that stuff. And so I said, I just not going to accept this. And so I started, saying, okay, I'm already working out like a maniac. I'm already like a world-class, world champion athlete. I'm training as hard as I can. I'm also being, a dad and an orthopedic surgeon, so busy as can be. So the only thing I had left was really, at this point, I think was nutrition, which I hadn't really, I wasn't ever eating like a junk food diet, but I was, wasn't really zeroed in on my nutrition. And so I went through what most people do is I went on a low fat, low calorie, lots of vegetables and lean protein diet, and I lost weight. It worked. And I don't deny that works, but I was literally a miserable person, and everybody that was around me was not, they were like, we much prefer the jovial diet, the implication, we like you fat, dumb, and happy instead. But so I realized that wasn't sustainable. I could not continue in this sort of what I felt was cardboard, not enough dietary fat sort of diet. And so I started playing. I went on a paleo diet, then a low carb, then eventually a ketogenic diet. That took me about 5 or 6 years. Then I discovered these crazy, nutty, wacky, weird people eating all meat, online. I said, these people are nuts, right? That's everybody's impression. And I was just kind of curious enough to just kind of read more. I was just intrigued. It was like watching like a horror movie. I was like, what the hell is going to happen next? And I was like, wait, something's starting to make sense to me. In whatever reason in my mind, it made sense. So I went and tried it, and I was like, I'm just going to do it for a day. And I did it for one day. I had steak and eggs all day. And I was like, I felt pretty good. I liked the food. And then that led to like 2 days and a week. And then finally I did it for a month, and I was starting to get a little bit of an online, presence a little bit. I think on Twitter back then, a couple thousand people. I said, hey, I'm going to do this for 30 days. What am I going to die of? Because clearly I'm going to die. Nobody could survive eating just meat for 30 days, right? And it was, well, you're going to have a heart attack. You're going to get scurvy. Your colon is going to fall out from lack of, fiber, because the microbiome is going to eat your colon because you don't have fiber in there, right? And of course, none of those things happened. And I felt like literally, I was like, man, I feel like 10, 15 years younger. Nothing hurts. I'd had, these chronic aches and pains that you get as an athlete. And I've been, rugby, Highland Games, powerlifting, all these things can be tough on the body. And those things just went away. And I was like, man, I feel literally like I'm in my 20s or early 30s again. So I did it for a month, and then it was like, okay, that's just an experiment. Let me go back to kind of a more normal diet. And literally 24 hours of the normal diet, I just felt like I was my age again. I was like, okay, I'm back to being 50 again. I was like, this isn't good. So I went back to the all meat thing, and I've literally been on it for now almost 6 years now. So that's kind of the genesis of where I am now.
And what inspired you to write the book and really jump all into this? Because obviously your online presence, your book, and it's carnivore is your real focus. Tell us
Yeah.
a little bit
So
more about that. How you
yeah,
got
I
it?
mean, it was kind of interesting. I had no, and again, I never would have thought I would have written a book or been an author. I don't even like write. I can barely speak English, I think sometimes. No, but I mean, the publisher literally approached me. They literally said, "Hey, can we talk to you? There seems to be a growing interest in this carnivore diet, this meat only diet." It wasn't called the carnivore diet then. And they said, "Can you write a book about this? Because you're kind of one of these vocal proponents and you got an MD behind your name." I said, "Okay, I'll do it." And so I spent a couple months and went back and forth with the editor, and I wrote it. I named it the carnivore diet. It wasn't previously, it was called the zero carb diet, which was
Mhm.
kind of confusing for a lot of people because it was like, well, zero carb, can I have Diet Coke? Can I have Mazola oil? Can I eat, I mean, it was just all this stuff that really wasn't the essence of what we were trying to convey. It was like, this is animal products. And so I came up with the name, the carnivore diet, and then obviously after that, I got on Rogan's podcast, and then it was just kind of all hell broke loose after that. But yeah, I mean, what inspired me then and what inspires me now is, honestly, I'm a physician. I want to see people get healthier. And I think that's why we get into this. And then we kind of get sucked into the system. And then so many people they just get beat down by the grind, this is the way it is. This is the way you got to deal with insurance company. This is a coding, and this is a billing, and you got 15 minutes, and you got these algorithms you need to follow. And if you want to get your attaboy, you need to make sure 80% of your patients are on this drug or that drug for this condition. It just, it's just a tough environment to be. And I don't, like I said, I think I'm very critical of the medical system, and I think rightfully so, but I think there's most people in there are good people. It's just a system. It's just not, it's not serving the purpose it should be serving, quite honestly.
Are you still in practice of standard medicine, or are you primarily focusing on Rivera Health? And you could tell us more about that also.
Right. So I have an active medical license. I keep that active just in case, but honestly, I probably won't. I haven't operated since 2015. I mean, I started focusing on this and lifestyle. I still see people in a sort of a lifestyle consultation capacity. So I still have direct interaction with people, and, I don't prescribe or deprescribe or diagnose any of the medical things, but we talk about lifestyle and how to get people fit and healthier and those things. And so I still enjoy that aspect of it, but yes, my full focus is developing this company, further. We just went through our first initial fundraising round. We raised a nice amount of money. And so now we're going to be able to sort of bring this to a larger scale of people. And, our goal, like I said, our goal, our entire reason for being is to get people off meds, reverse diseases, cure disease, if you can even call it that. I know it's kind of it's like you're shamed for saying you're trying to cure a disease because it doesn't exist right anymore. We're so used to the medical disease maintenance paradigm. We're just going to maintain you and manage your symptoms. And it really is. It's not even disease. It was, they started calling it disease management. You probably remember that. And I think it's just disease maintenance. You just maintain people in a state of disease and play with their symptoms a little bit. And I think that's where we're at. And that's not where I think we want to go. And I think most people don't want to be there.
And so, what type of in the medical field, and I'm sure you work a little bit in it and see docs and talk to docs or patients, what type of pushback are you getting on this stuff?
By and large, I think the most people that interact with the deign to interact with me has been pretty positive. I mean, yeah, there's people that from, on the side will say, well, this guy's a moron, or this is stupid, or I don't like meat, or, I mean, there's obviously people that are biased that think eating meat particularly is just so bad for us. And, it's like instant death if you eat, more than 3 ounces a day or something like that. So there's some of that. And there's some people that don't understand it. And there's some people that I think are just confused. A lot of like, this doesn't match what I've been trained. And yet I'm seeing, a constant barrage of people that are literally coming off medications. And you can't deny the objective. I mean, this person is now 100%, 100 pounds lighter than they were. They're no longer on all these medications. You've got objective evidence that their colonoscopy shows they used to have Crohn's disease and it's gone, or their ulcerative colitis is gone, or they're more in your field, there's PCOS and their cysts are gone. All these things. It's just like, how do you process that when everything you've been taught is the opposite, And so there is some, but I think we're seeing more and more like yourself. I mean, there's more and more physicians out there that are saying, okay, wait, I'm just going to, do what works and listen to my patient, because we talk about evidence and what's the strength of evidence. Well, patient results are evidence in my view. I mean, they really are. And to say that you need an RCT, it's not that we don't need to and shouldn't do those things, but to say I need to wait for all the evidence or the ideal study to be done before I do something that I think is going to benefit my patient. That's the art of medicine. And I think, when we talk about, there's evidence, which I mean, gosh, you look at how the evidence is acquired, some of the funding is goofy and where the data is being hidden and the negative results are not being published. This is, kind of a knock on the pharmaceutical industry. But then there's, you take it, the clinician's experience that counts for something, and honestly, it counts for quite a lot. And if we ask patients what's important to them, I don't think they could care less what their numbers are. They just want to be healthy and feel good and not be burdened with disease and not be in pain and not be sad and depressed and, hurt every time they walk across the room. I mean, so I think it's, we have to align the goals of everybody and put them where I think the patient has to come first in this regard.
Well, I'm really excited that you're here talking to us today, because having more clinicians and people that are really inspired, but that actually have done it themselves, is so important. And I had dinner with 3 doctors last night, and one of them, we talked about this, and I eat my steak, and this is pretty much butter and salt. And one guy's like, "What are you doing?" And the science just doesn't back it up, is the biggest problem in our medical field, right? We're looking for the scientific studies that prove it, and yet the proof, be how you feel and how your clients feel after experiencing carnivore. What's your thoughts, and how do you talk to people about keto versus carnivore, and the nuances of those sort of things?
Yeah, I mean, well, there's obviously some distinctions there. And just to be clear, I don't necessarily think everybody needs to be on a carnivore diet. I don't know if it's even the best diet for every single person, but I do know that it can be extremely effective for many people, and it's worth trying for many conditions. And so keto obviously in the name, sort of indicates that you're going to be in ketosis, right? So ketosis is when, you start, you reach a certain threshold. If you listen to Jeff Volek, Stephen Finney's definition, 0.5 millimolar ketones in your blood, and you want to be in that position, because that means you've kind of shifted the balance a little bit more towards fat lipolysis rather than so much glycolysis. And so there's this sort of, I'm going to eat things that cause that to happen for me to be in ketosis. And some of the side effects might be my hemoglobin A1C gets better, my glucose is stable, I might lose some weight, I might feel better, and certainly people do. And there's a lot of research on keto now showing all kinds of beneficial effects for all kinds of diseases. I mean, I know there's studies, Chris Palmer at Harvard's doing some great work around mental health stuff. I mean, there's stuff, guys like Dale Bredesen and UCSF looking at Alzheimer's disease. And we just see a lot of now research coming out there. Dom D'Agostino's done a lot of great work. But I think with a carnivore diet, you certainly can do it in a ketogenic style. And there's people who call it ketovore, keto animal foods, or Paleolithic ketogenic. I mean, there's all kinds of versions on that. And I think that can often be beneficial. I don't personally, in my own life, I don't really worry about it, whether I'm in ketosis or not. I look at like, what is my ultimate goal here?
Mhm.
And if my goal is, I want my ketones to be 2.0, I mean, that's great, but does it mean I'm healthier or not? And I don't know. I mean, it could be, it may not be, and it may be correlated, or it may be loosely correlated. So I look at a carnivore diet, or really, and again, if you're not getting results on a carnivore diet, don't do it. I mean, and it's not like an ideology, sort of like a vegan diet. It's not reverse veganism. It's just like, this is something that works really well for health, for certain conditions, for certain people. And if you're not getting those results, please, by all means, do something different. But I think, the goal is, hey, let's get healthy. Let's get, if you look at what a carnivore diet is, it's an animal-based diet. There's no processed food in there, pretty much by definition. With a ketogenic diet, you can walk through any grocery store and see keto junk food everywhere. It's keto on this, keto crumbles and keto bites and keto, everything's got keto on it. And you look at the ingredients, it's just a bunch of garbage, right? You don't really see that with carnivore. There's some people that kind of trying to, calling jerky carnivore, and it's all got, some junk in there. But so, I mean, there's that. I mean, there's no real processed garbage. And I think really, if we look at why we have a situation like we do, it is the immense amount of ultra processed food that we eat as Americans and Westerners. I mean, it's 60% of our diet largely. So you eliminate all that, first of all, and then you're providing high quality protein, and animal source protein is clearly better than plant protein. I know there's people that push back on that, but I mean, at the end of the day, the overwhelming evidence, you can look at the PDCAAS, you can look at the DIAS, when you look at the digestibility indices of all these plant versus animal proteins, plant proteins are always inferior in just about every study you've ever looked at. You can kind of construct something using isolates, and if you balance everything, you can get a similar muscle protein synthesis. But then you don't even consider cholesterol. Cholesterol is anabolic, and so again, my sort of belief is that lean mass is beneficial to our health. You know, I mean, you don't have to be a giant, super muscular guy, but you need to have a decent amount of muscle. I think just as concerning as obesity is, the other side of the spectrum, frailty and sarcopenia, are also there. And, you know, particularly with women, particularly with older women, you know, that's a real issue. And I think, you know, an animal-based diet that's higher in protein, that completely eliminates the junk food, that's highly bioavailable, you know, is a good answer for a lot of people.
Well, it's interesting. I've always, to me, it's the plants that are the poison, and you know a lot about the plant phytochemicals and the antigens and even the microbes that come with the plants. And maybe you could talk a little bit about fiber and is it good and bad and why?
I think it's a question. I think that it's a relative framework where you start at. I think if you're looking at the average American eating the standard ultra processed junk food diet, the addition to fiber in the diet is generally going to improve the overall quality of the diet. And there's some studies that will suggest that fiber intake is associated with socioeconomic status, and we always know that people that have more means tend to do better on all health outcomes. That's pretty clear. And people that are eating fruits and vegetables, you know, tend to have a better socioeconomic picture than people that just have to survive on this ultra processed stuff. And so you think about what are the proposed mechanisms by which fiber improves things? Well, glycemic variability. It seems to, like, you're eating the classic example is an apple versus apple juice. You know, they've done isocaloric examples, you know, with 50 grams of carbs from juice and 50 grams of carbs from apples. The glycemic excursion is much lower with the fiber in there. So that's a benefit.
Mm-hmm.
You know, you can talk about things like, well, the biggest thing now is microbiome. You know, everybody's talking about, well, you have to have fiber to feed these gut bacteria, which then produces short chain fatty acid, primarily butyrate, which will then nourish the colonic lining and protect it from, you know, whatever they want to say it protects from. And so all those things, you know, like, you know, for instance, we talked about, and the other thing was satiety. You know, if you just fill your guts up with a bunch of fiber, like a gorilla, you know, gorillas eat 75 pounds a day, by the way, and they spend 80% of their waking hours chewing and defecating. So, I mean, yeah, so you can use that strategy where you fill yourself up and that provides a satiety effect. And so there may be some weight loss associated with. There's a slight benefit cholesterol if it lowers your cholesterol. I think that's debatable whether that's good or bad, in my view anyway. And so all those things, you look at all those things. Well, I mean, first of all, you know, when you're eating a carbohydrate-free diet, the glucose excursion generally is not an issue because you've got a fairly low, you know, unless you're just eating pure protein, you might see a little bigger spike, particularly if you're a diabetic. But so that effect is kind of basically neutralized. The satiety effect, I think for most people, eating, you know, an animal-based diet is very satiating for most people. Not everybody, for most people. So the satiating effect of fiber is kind of mitigated there. I think the other big one is the butyrate. And so if you look at butyrate, there's something called beta hydroxybutyrate, which I'm sure you're familiar with, which is, you know, the primary ketone body that circulates. And beta hydroxybutyrate is literally one hydroxyl, you know, molecule away, an OH molecule away, and it's very easily interconverted. And so when you're on a lower carb diet, your ketones are going to be going up to some degree, and those colonic mucosal cells are well vascularized, and so they are still being bathed in butyrate, regardless if you're getting exogenously through the microbiome or internally through the beta hydroxybutyrate. And additionally, you know, we know that things like protein break down into the short chain fatty acids as well. There's methylbutyrate, there's propionic acid, there's acetate. And several others in there. So I think all the beneficial effects of fiber are really relative to a junk food diet. And so when you're not comparing a junk food diet to, say, you know, a healthier diet, I think some of the benefits wear off. And there's a number. So in fact, there's an interesting study I just looked at today. It's called Fiber and Colorectal Cancer, I think, or colorectal disease, separating fantasy from reality or something like that. It goes through a lot of these things and saying the data is just not that strong that it really protects against these things. So I think there's a lot of sort of, you know, this belief that Dennis Burkitt, you know, back in Africa, was discovering that these people, I think in Uganda or somewhere, were eating a higher fiber diet, and that's why all their health was better. And it was like they weren't eating sugar, they weren't eating garbage, you know. And so it's one of those things where you don't know if that's the case or not.
You know, the one thing about medicine and science is very complicated. And so it's been made actually so most of us can't really understand it. So, you know, there's the experts know the answer. And so they make our recommendations and then we live by them. What's your thoughts on healthy people getting cancer? Why do healthy people get, they look healthy and they're exercising and eating a healthy diet? What's going
Well,
on?
I mean, gosh, that's a really complicated question. I mean, the easy answer, if you look at the common risk factors for cancer: obesity, visceral fat, hyperinsulinemia, diabetes, chronic inflammation, all those things. I mean, some of these people that are quote unquote healthy, maybe they appear healthy, and I hate to sort of, because I think appearances are important. I think having a physique that is lean, athletic, generally confers an advantage to people. But yeah, I mean, there's certainly some people that will be in that category, get cancer. I think they're probably in the minority. If you listen to guys like Thomas Seyfried, who thinks that cancer is quote unquote a mitochondrial metabolic disease, and it may be that their diet is leading to that, and maybe they're on it. And you have to look at what their diet is, perhaps, and look at some of the other habits. But obviously, that cancer clearly has a number of factors that affect it. I think diet is probably a big one, though.
Well, my suspicion, and I've interviewed and talked to Thomas Seyfried, read his book, and I think that ultimately that probably is the single leading factor for almost all cancers. But it's because we make it so scientifically complicated that most of us can't really understand it very well. What's your thoughts about fat versus food? And maybe this leads to the same, cause of diabetes. My sister died of diabetes. My best friend, healthy doctor at 52, died of cancer. And it sort of led me really to dig deep into the understanding that maybe fat has nothing to do with disease, but it's strictly the food, which is ultimately the real poisons, because the foods we're eating are meant for grazing animals rather than hunting animals, which we really are.
Well, I mean, I would agree with that sentiment that, we're not really designed to be grain eaters. I mean, that's not part of our evolution. And, some people sort of don't sort of believe in evolutionary model exists and think it's made up. And I tend to believe that. And I think there's pretty strong evidence of what we did for most of our existence as a human species. Now, remember, humans go back farther than Homo sapiens. We go back 2.8, 3.4 million years, depending on what you think humans started at. But so clearly we were eating a lot of meat and a lot of, meat fat that came with that throughout the years. And I think that, the sort of the development of agriculture kind of out of necessity, certainly allowed for civilization to bloom, because we could be geolocated in one area and we didn't have to be nomadic anymore, came with a cost, and the cost was to individual health. And we know that, for instance, our brains shrunk 150 cc's, about 10% of our brain volume was lost. Now, some people argue it's lower quality nutrition. Some people say it's no longer the need to think as much. We kind of outsource our brain to the community, and we're seeing that even more with the smartphones, right? You can't even figure out how to add anymore. A lot of people can't do basic arithmetic without pulling out their phone. And so some people think maybe brain size was lost. We certainly got smaller in stature. Our dental health got worse. Our bones got weaker, all those things. But I think, I don't want to say fat gets a complete unlimited pass, because there's different types of fat. It's not just mono, poly, and saturated fat, but there's different subtypes. Among the saturated fats, there's the short, medium, long chains, and the oleics and stearic acids and palmitic acids. And it's not necessarily the fat we ingest, but it's the fat that populates our bloodstream that might have an impact. And I know a lot of plant-based advocates will say, well, diabetes is because fat is clogging up the cellular mechanisms and causing the insulin receptors and signaling molecules not to work well. And it's due to ceramide accumulation. And that's all due to saturated fat in the blood, and particularly palmitic acid, there's some truth to that. But the problem is palmitic fat that circulates in the blood is largely made by our liver, and it's made in response to usually overconsumption of food, often calories, often fructose. And so you're just turning through de novo lipogenesis, you're just turning these carbohydrates into fat that floats in the blood, and then that goes and clogs up the machinery. And so they kind of leave that step out. Because Jeff Volek in 2013 showed that eating saturated fat was not correlated with circulating fat, saturated fat in your blood. In fact, it was even less, which I thought was kind of an interesting study. But to say, I think, when you said we're not designed to eat grains, I don't know that we're designed to eat concentrated fats either. So these, on the ketogenic diet, it was popular to eat sticks of butter and chug heavy cream and just unlimited fat. And I don't think that's right either. I think, when we look at what's natural, if I'm eating the closest thing to a mammoth these days is probably a ribeye steak. It's got a certain, fat to protein ratio. And beef, for instance, is interesting because it's got 50 some thousand different individual nutrients. It's just not a few vitamins and minerals and protein and fat. There's 50,000 different compounds in there that all have impacts on our nutrition, most of which we don't know what they are. I mean, some of them we're starting to look at, like creatine, carnitine, carnosine, anserine, taurine. Those things, we're starting to understand, vitamin, D3 and K2 and some of these things that we're seeing in animal products, we're starting to tease that out. But so I think eating foods is close to their natural form and not hyper concentrating. It's like the protein powders. I mean, I think the protein powders are very similar in effect to like flours and sugars. We're not designed to eat powders, in my view. I mean, where do you think in nature you could turn something into powder? I mean, you just can't. I mean, you might have to chew for like 12 hours to powderize something.
Never, right.
Right. And so you think about how when that hits our digestive tract, the surface area is so incredibly increased, and it just bypasses this very temporal digestive process where you've got, the incretin hormones, GIP up in the upper intestines and GLP in the lower, GLP-1, GLP-2 in the lower intestines. And that entire temporal sequential process is just disrupted because it's just rapid absorption of all these nutrients that we would have never been exposed to before. So,
right. So what likely was the ratio of fat? And we say meat is made up of fat and protein. I mean, amino acids. I mean, we're really given a very basics, but likely when we were eating and killing an animal and eating it however many thousands of years ago, we weren't saying, let me have the tenderloin or let me have the fat, which piece do you want, right? So what do you think was or is and should be the optimal sort of ratio of the white stuff to the red stuff?
Right. Well, I mean, and I think there's a little bit of nuance, and I think some people are going to have a little different experience with that. I think men and women might even have a different ratio that's ideal for them. But if we look at it, and you look at guys like Mickey Ben-Dor and Ronnie Bark out of Tel Aviv, and they've done some extensive research on human hunting, human evolution, and how actually Homo sapiens theoretically evolved. And they did a really nice paper on just overall what we were eating, and they looked at everything: fossil records, isotope studies, human physiology, genomics, everything they could look at, and they came to the conclusion that humans were heavily carnivorous for sure for much of our early process, and then later, as these big megafaunal animals, the mammoths, the mastodons, the rhinoceroses, the giant oryx and things that we were eating pretty much whenever we wanted. And the evidence is pretty strong that we could kill them without much difficulty because they didn't run away. They weren't scared of us, and they were everywhere. And so I think we had this sort of all you can eat elephant buffet. I know it sounds kind of crazy, but I think that's kind of what we did. And there was, evidence like the Gravettian mammoth hunters in Central Europe doing this. And so we know that the larger the animal is, that they tend to carry a higher percentage of fat. And so I think that's what we had to choose from. So I think probably we were eating a higher fat to protein ratio than what we see a lot in the grocery store these days, with the exception, ribeye steak, which by calorie, 60-70% fat typically, and 30-40% protein, depending on how marbled it is. I think that's probably where most people sort of find themselves to be comfortable at sort of maintenance, at rest. I think if you want to be leaner, then you may remove a little bit of that. But I think in most people, again, I don't know that you have to gorge on fat, but you have to have an adequate amount of fat. And I think there's some proposal that like 35% protein is a theoretical upper limit for protein consumption. Although I don't know that ratios make sense. It's probably an absolute amount that's probably more in line with what we should be doing. And so somewhere in that thing, I see people be successful from anywhere from, I don't really see too many people long-term having success below 50% of their calories coming from fat. I see people going as high as 80 and 85% doing okay. So somewhere in there, and I think it varies per person. And again, it depends on where you're at from your weight loss journey and where you're at from a disease state.
I mean, essentially, before insulin and Dilantin for seizures, both diabetes and seizures were treated with a ketogenic diet. We know that. And the pharmaceutical drive of disease, drugs, and then subsequently you get other diseases and side effects from the drugs, which is really the push of the world today. How do you coach and counsel people in sort of starting this journey to carnivore?
Yeah, well, I mean, I think most people commonly share some problems with food. I mean, they have kind of a bad relationship with nutrition in general, and so most of them want to lose weight. Not all of them. Some of them want to bulk up and get strong. I take care of a lot of athletes, but for the most person, someone's dealing with disease and obesity. We just have to sort of say, well, let's fix our relationship with the food we're eating, because it's not that they can't from time to time have discipline and get on a diet and lose weight, but they always fall back into this really destructive eating pattern. And so I think that's step one. You have to sort of address that. And I just tell people, let's get highly nutritious food in you. Let's get as much as you care to eat so that you don't, people ask me, well, how much should I eat? And I say, hey, just eat enough so you don't want a cupcake or whatever your trigger food or trigger foods are. And I think that's initially how I approach it with most people. And then from there, obviously if someone's on a lot of medications, you need to involve your healthcare provider to help you taper off, because if you're a diabetic, you're probably going to be reducing your insulin. You're probably going to come, if you're still on a sulfonylurea, which hopefully not too many people are still taking those, but those things will have to come off. We see a lot of people with blood pressure meds. They have to reduce their blood pressure meds relatively quickly. Otherwise they end up with hypotension, and then they, get wobbly and fall down. We don't want that either. And, the anti anxiety and depression meds, a lot of people are able to taper those down. So I think if you're on a lot of meds, involve your physician, please. Don't just do this, because there are potential scenarios where things get problematic. And so those are things we talk about. I'm a fan of protein. I like people getting an adequate amount of protein. I think our dietary guidelines under recommend protein. I don't believe it kills you. I don't think it makes you age. I think there's some caveats to that. I think you shouldn't just mindlessly drink protein powder and sit on the couch. I think you should put that protein to work, and you should be doing some sort of activity. Now, not everybody can do that right away. I mean, a lot of people, they're hurting. And to tell people you got to spend an hour in the gym, and they're like, I don't even want to walk down the street because my knees hurt too bad. It's not fun for them. So you have to kind of sort of say, okay, let's fix your diet. Likely, and this is the neat thing for me as an orthopedic surgeon, I saw so many people that had fairly severe arthritic or joint pain or tendonitis. It just goes away on diet, which is just amazing. And then they're like, well, I don't hurt anymore. Well, then good. Now you can go for a walk, and now you can start to build up. And so, like I said, there's a progression, and obviously depending upon the unique situation, there's some unique things, but in general, it's like fix your relationship with food, eat plenty of food and enjoy it. Don't just sit there down to a plain old bowl of ground beef with no seasoning and sit and think you're going to do that. I wouldn't do that. I'd be like, you're crazy, man. I'm not doing that. So give me, do some variety, enjoy it. You might have to remove some things later if you're dealing with something particularly recalcitrant, or you're like some weird autoimmune disease or something like that. But in the beginning, it's just like, let's just get used to not eating the starches and the other plant-based foods that you're so accustomed to eating, and just kind of get used to filling up on these animal foods and then you go from there.
What about fish? My opinions on fish. Well, tell me what you're thinking about fish versus land animals, and then what other variety do you throw in there related to the animal?
Right. Well, I will tell you, I can tell you my thoughts on that, and I'll tell you what I actually eat. So what I actually eat is about 99% red meat. That's what I eat every day. Sometimes I'll throw an egg, but I will have fish occasionally. I don't know that I just get whatever the oomph is, the visceral enjoyment from fish. I have it. I don't think generally it's bad. Some people say there's mercury and some other issues around fish, but I'm not so concerned about that as a major concern. I think about just, and I talk about this in the book, and I still think it makes sense because I'm talking about stuff that happened arguably 1.5 million years ago. If you and I were out hunting and we had a spear, which is what we had, how much time would it take you to go kill an elephant and get 3,000 or 3 million calories? And how much time would it take you to chase around birds or even chase fish? It's just not very time efficient. So I think when we're talking about growing, and this is debatable because a lot of people see, the coastal migrations and the access to fatty fish, and that's how our brains grew. But I think, you can certainly get omega-3s from animals, both grass-fed and grain-finished. You don't need a ton of that, quite honestly. And I think that there's nothing wrong with fish in the diet. I have not seen anybody successfully do a fully pescatarian carnivore diet. I just haven't seen that happen. I think for some reason, the ruminant meat seems to be at least a key player for most people. I know arguably I've got even people in India doing it, and they're using fish and eggs and chicken, and they're usually putting in some lamb or something like that, or goat or something like that, because it's not, those things aren't prohibited for them.
And how about number of meals and fasting? You want to talk a little bit about that and share your thoughts and ideas?
Yeah, I think that again, there's a kind of a belief that humans fasted and that was natural, and you certainly can see it in the record. We just got for the members of the Muslim community that's got finished through Ramadan. I was in Dubai for Ramadan, and people said, "Don't go to Dubai during Ramadan," but it was fine. There was no big deal. I didn't have to fast at all while I was there. But I think that clearly, in my view, humans, at least prehistorical humans, probably did not eat very frequently. And I think the reason for that is, if you're nomadic, I mean, and again, I'm going to assume they were cooking in many cases. Maybe they weren't, but I think mostly they were. It's a lot of work to prepare a meal when you're out in the wilderness and you got to build a campfire. And so I think they probably ate maybe once a day, maybe twice a day at most, maybe a morning meal. And then when they walk, but I don't know. I mean, you can't say for sure, but I mean, I know with this diet, I just naturally am not hungry for much of the day. I mean, I would say for 90% of the time I've been doing this, I eat 2 meals a day. And that's probably the majority of what I see anecdotally. And I don't really care what people eat. I tell them, eat when you're hungry. And usually after a while, when they're hungry, it's twice a day. It's hard to do once a day on this diet for many people, just because trying to eat a full day's worth of calories through meat in one meal for most people is challenging. If you need 3,000 calories a day to get through the meal, that's 3 pounds of meat, basically. Most people can't sit down there and do that. I can, and I've done it many times. I mean, I've done 5 or 6 pounds in one sitting, which is kind of ridiculous. Sure. But I don't even like doing that. I mean, I know after about 2 pounds of meat, I'm like, I'm good, I'm full, and I don't want any more, and that's a good meal for me. But if I have to stuff myself to eat another meal, then I'm just not enjoying the food. I think that fasting, like I said, I think the problem we have today is the constant eating. The average American starts eating at 7 a.m. and doesn't stop eating until 10 p.m. and they're just constantly eating 16 hours a day. That's clearly not what we're supposed to be doing. I think the food choices we're making drive that hunger. When you're constantly eating the snack foods, it provides very little nutrition. It provides some calories, and it doesn't provide much satiety. So you're constantly just little glucose and insulin, ping pong going back and forth. So you continue to have to deal with that. And so I think for some people, particularly people struggling with obesity or other sort of satiety recognition issues, fasting can be helpful. Putting an eating window there is a nice external crutch that helps you. I think a good diet will do that naturally, and maybe you don't need to do that. But I think in the beginning, I don't have a problem with that. I think, people doing, longer fasting very frequently, where they're doing, 3-day fasts every week and stuff like that. I think there is some problems with that. Potentially, you can mitigate those through getting adequate protein and doing strength training while you're doing it, so you don't lose too much lean mass, because it's not just about weight loss, as it's about losing. When you lose weight, you want to maintain as much lean mass as you can. You're not going to maintain it all, but you can mitigate that through some smart strategies.
Tell us a little bit about exercise regimens that you recommend. Cardio versus strength training versus resistance, or just going for a walk.
I think all of the above, quite honestly. I mean, I think you are remiss not doing strength training, particularly as we get older. And it doesn't matter if you're male, female, it doesn't matter what age you are. Strength is going to protect you. I mean, the correlations with strength and longevity, strength and, protection from cardiovascular disease, cancer, neurodegenerative diseases, diabetes, on and on. They're all over the place. So it makes sense to be strong. You don't have to be Mr. Olympia and a super giant bodybuilder. You just need to be in the top quartile of your age cohort. It's going to be the best protection. And that's not very hard. I mean, unfortunately, the top quartile is not a very high bar these days. So just doing regular strength training is important. I think the cardiovascular side is also equally important. And I think there's a couple ways to get there. I'm a big fan of, interval training, sprint training. I do that. I just got done running a 400 meter sprints today. But I think doing that to some degree is very effective. But I also, the long, steady state stuff. I mean, I went for literally just before I got here, I took my dogs for about a 45-minute walk, and I had a 50-pound weight vest. I was just walking around with a weight vest on. So I think all of the above can be effective, and we should do as many of those as possible. Now, obviously, there's time constraints. You don't need to spend 2 hours a day. You can get some of this done very, very effectively. I mean, I think the data on, muscle hypertrophy, which I think is important, it shows that with, 10 sets of a particular body part, maybe it's chest and arms, and you're doing 10 sets of push-up. per week, provided you're going close to failure, near failure, close to failure, that's adequate. That's sufficient to build muscle. And so you don't have to, you can get that done. How long does it take you to do one set of push-ups to failure? For most people, it's a minute, and so you figure that's 10 minutes a week.
It's about 10.
Yeah, whatever it may be, once you get better, hopefully you go a little longer, but yeah, it's something like that.
Encouraging people to just get up and out and move your body. It's so critical, but getting active with yoga, I just remember just calisthenics. We did a half an hour calisthenics, which was just utilizing our own body without any other resistant tools needed. I thought was kind of always pretty good, which I tend to work towards more. I'm getting closer to the 70 age group.
Sure. Yeah, but like I said, you just, I think particularly as you get older, the more you shouldn't take any time off at all. I mean, it's just something that I've discovered. If I take more than a day or two off, it's like you got to stay after this stuff. And I think progress. I mean, if you're depending where you're starting, it's one of those things you can always find some way to measure progress, whether it's number of repetitions, how long it took you to do something, how much weight you're using, how fast you could do something. So many ways to progress and just make it fun. And you got to enjoy it. But the point I made earlier, if you're in pain and you hurt and you've got injuries, I mean, you don't want to push through that stuff necessarily. Fix the diet, give diet a chance to start working. Because I can tell you, and Rob, you can probably confirm, diet impacts your joint health and how you feel. And if you fix your diet, those pain, because it's not fun to go out and work out when your back's hurting all the time. It's like every time I move, my back hurts. If that stops, it removes a huge roadblock in front of your way. And so you get into this sort of, instead of this negative feedback loop, you get into this positive feedback loop where you feel better, you start exercising a little bit, you start looking better, and then it just continues to progress. And then you become some crazy evangelist and everyone wants to share up.
And we're sharing it all over the world because we know how good it feels. I've been doing carnivore over 10 years, and I used to have every injury and every disease, and it all goes away, including lower back problems go away, which I think it's all related to the bowels. And, when you remove the inflammation from the bowels, you actually remove the inflammation from the rest of the body, which is pretty amazing.
I think there's multifactorial things when it comes to joints. So I do think that, our gut function, our gut inflammation, gut permeability, gut dysbiosis, all that plays a role clearly. Also, interestingly, I mean, there was a nice study out of I think it was University of Alabama, where they looked at, I think it was 2019, they looked at, high insulin levels, and, we shouldn't have super high insulin levels all the time, and diet impacts that. High insulin levels stimulate these things called fibroblast-like synovial sites, which are, the synovial cells are ones that line the joints and squirt out the synovial fluid that lubricates our joints. And when they are exposed to high levels of insulin chronically, they start to produce these inflammatory cytokines, which then go on to actually damage the joint and lead to arthritis. And so, again, these things, I think arthritis in a lot of cases is just a consequence of metabolic disease in many cases. There's trauma, of course. We get post-traumatic arthritis, but I mean, the typical just, I'm getting older, my joints are wearing out. It's not so much because you're walking and using them. It's because your body's inflamed and carrying all this extra fat around, this extra adipose tissue. Also, we know about the inflammatory cytokines those produce. So the systemic, you're hitting it from all angles for sure.
Yeah, no, it is quite amazing. And my basic theory is our real trouble is hyperglycemia, and because of a high plant-based diet, which ultimately fuels the circulation with glucose 24/7, 365. Since the day you're born to the day you die, pretty much. Because our bowels are always full of carbohydrates. They're never empty. So if you fast overnight or even for a day, because you're eating a complex carbohydrate diet, especially fiber, your GI tract is simply full of digesting carbs all day, all night from the day you're born. And nowadays, now we're seeing the baby formula is shortage. Because we're eating a plant-based baby formula, which just counter to everything we should be doing, which is breast milk for babies, and then basically animal products for everything beyond that of most frequency. But I've been talking a lot about the glycobiome, and how we don't know very much about the glycobiome and glycobiology, which I think is more important than the microbiome and everything else. But, some things that I also think insulin resistance is untrue, and glucose is never the energy for the mitochondria. But it's a hard one to understand because we know no one has no fat or fatty acids in their bloodstream and circulation ever. And I'm not sure why the mitochondria would use glucose and then switch over to acetyl-CoA from a fatty acid. But, that's a hard thing for so many of us. We're waiting for the scientists to give us the answer, but we know that the ancient optimal nutrition, or I think you use a species specific, is that species?
Yeah, I think it's species appropriate. I mean, I think I said, there was 2 million years where they had a chance to figure this stuff out, and they kind of trial and error figured it out. I mean, I just imagine there was a point where like somebody was maybe the plant tester in the tribe. Maybe they didn't like the guy and said, hey, go try this. And, if he lived, great. If he didn't, but yeah, I mean, I think we evolved, I mean, like I said, if you look at human evolution, I mean, there were hominid species that tried the vegetarian and vegan route, and they went extinct. I mean, you look at Paranthropus robustus and boisei, both of those, they were around for a while, and then they just went extinct. The climate and the environment did not tolerate their presence, because there's no more, they couldn't survive there.
I always wonder why A5 Wagyu steak, which is the fattiest steak you can buy, is the most expensive. And it's basically because it's the master's meal. And the masters feed the masses mush, which makes us meek, because we're addicted to plant products, because they're smoked, drank, injected, but mostly eaten, which ultimately makes us feel good. Plus, the plants come with the toxins and the hallucinogenics that make us want them more because they're addictive. And since the majority of actual carbohydrates and glycans are not even sweet, yet they all convert to a sugar in our bloodstream, which most of us don't even know that. But I was reading a paper on the effects of poisonous range plants on abortions in livestock. But basically, and there's a lot of evidence, and the United States Department of Agriculture has a great journal on plant poisoning for livestock, because livestock are much more valuable than human stock, in the sense of we sell meat and make money, but humans, when they're sick, we make money on their sickness, which is not necessarily, I'm not saying it's a conspiracy, but it's such an interesting concept and idea. That's why I say meat makes us masters and mush makes us meek, essentially. And it's pretty interesting. And I mean, I deal in the fertility world, and my belief is the majority of miscarriages and stillbirths, and also infertility, is strictly all the same problem that happens in the livestock world. It's plant toxins and other issues in that particular disease process.
Yeah, it's interesting that, when you look at the world of animal nutrition, particularly food animals, I mean, the nutrition science behind that is so incredibly robust. And I mean, because literally, they can kill them at the end. I mean, you can't do that ethically with humans. You can't control, and they control every aspect. So they can really look at exactly how things are affected, and they can monitor them. With a human, you can't do those studies. It's just unethical. And so we're kind of left to guess. We're like, well, hopefully our grandparents picked out the way, and now it's like, hopefully these companies have our best interest in mind with their Reese's peanut butter flavored cereal, right? I mean, it's just, it's obviously clearly garbage done for profit motive. And I'm being, clearly they don't have our interest in mind, but it's interesting to see that. And I clearly, obviously you deal with women's fertility much more than I do, but I even from my perspective, I see women with PCOS, with different dysmenorrheas, with different, with perimenopausal syndrome, infertility, get better when you change their diet. I mean, they routinely say that.
Well, the let's see, the birth control pill is made from plant products, and the abortion pill is made from plant products, essentially. And so, it's kind of no wonder that if we're eating a high plant-based, low animal fat diet, we're so diseased in this process. What are your thoughts on alcohol?
I don't think alcohol is a health food. I mean, I think it's, I don't, I don't think that you can drink it in moderation. It's going to extend your life, which some earlier studies suggest. I get why people do it for sure. I mean, and I, to be truly transparent, I have a glass of wine occasionally, not very often, but I mean, once in a while I will. But I don't go to it thinking, oh, I'm going to have this because it's heart healthy because it's red wine. I just think you just have to sort of, I mean, and there's clearly people that overconsume that for sure. And so I just don't have a great desire to do that personally. And people ask me about how does it affect the diet, and I will say this is an interesting fact that I think is interesting. We do know that saturated fat has a protective effect against the damage that ethanol does on the liver. It's been shown both in animals and in human studies. So if you're gonna drink alcohol, have a steak with it. I mean, I think I can say that, but again, I'm not encouraging people to drink.
I've always thought about the statement, publish or perish. So ultimately, all science is just a publication of a belief system, and actually may not be true. And that's one of the challenges with most published science that I think is so difficult. And I recently found a book by a Dr. James Henry Salisbury. And I did not know that Salisbury steak was described by a Dr. Salisbury.
Right. Yeah. Mid 1800s. Yeah. Right. Yeah.
He graduated Albany Med in 1850. He was a chemist and a microscopist, but he noticed that his men in the Civil War were dying of dysentery. He gave them steak and coffee. They all got better. He then did experiments on them where, I mean, these are well written, documented experiments where he fed them the beans and the cereals and the hardtack, they called it, which is crackers. And many of our patients, when they get nausea and vomiting in early pregnancy, they're told to eat crackers, which I believe are deadly for us. But the scientific data is there for everything we're talking about. There's only one scientific experiment that needs to be studied, and that's the human being that's suffering and needs to do it themselves, which is really quite remarkable. That we're here not arguing a point, we're sharing a success of life. And as carnivore, it is quite amazing. Tell me a little bit, Shawn, on where Revera Health and how people can find you and what things they can gain by going to Revera Health, and what type of people maybe are there that can help them on their journey.
Yeah, I just want to add, you mentioned James Salisbury, but prior to that, there's a guy named John Rollo, who was a Scottish surgeon you may know as well. And he's also this is in the late 1700s. Same thing, all meat diets, fixing diabetes. This goes back a long time. And then, of course,
which I think, if you look at the Mongols and you look at the Vikings, these are the two groups that pretty much ruled the world.
Right.
And we're all related to both of those. And so ultimately they were hunters, and they were not grazing, nor are they agriculturalists.
Yeah, it's kind of interesting. I went to Iceland, several years ago to talk about this carnivore diet, and I wasn't received as a crazy person because they're like, "Hey, we live on a frozen island in the middle of the North Atlantic," And it's kind of like, there's not much mangoes growing around out here. They got some fish and they got a few animals grazing. So, but with your point about your question about Revero. So yeah, Revero is a company that we started, we started out as a company called MeterX, and we've kind of evolved to this Revero, where it's kind of in the name Revero. Our goal is to reverse disease, and our goal is to get people off medications as opposed to, like I talked about, disease maintenance. So this is by any and all means necessary. How are we going to get you off your disease? How are we going to fix you? It's going to be diet. It's going to be lifestyle. It's going to be exercise. It's going to be having physicians that are aligned philosophically to understand that our job is not to fill out, the coding stuff. It's we want these people better. We've got coaches and support communities, and we're developing. So some of this is still being developed. I have to say we just raised $5 million to develop a lot of this stuff. We do have a carnivore community, which is now found at carnivore.diet. We've kind of separated that off, and that is what we've been doing up to this point. So we've got people that can coach you on carnivore. I provide consultations. I spend every day an hour every single morning, every 7 days a week, 365 days a year, unless I'm on a plane somewhere, just with conference with people. Anybody wants to jump in there as part of the community can ask me questions, and we talk about things, and we, shared success stories, and we talk about struggles and that type of stuff. We've got all kinds of resources, it's all the literature. We've got literally thousands of articles of scientific research. We've got links to where you can find a rancher. We've got discounts on meat. We've got just all kinds of recipes, all this stuff there. So that's what's over there. I'm there every day. And then of course my social media stuff, where I kind of do goofy stuff, but it's, it's kind of just try to get the message out, kind of some entertaining stuff.
And I really enjoyed it. I was looking at it, and I was noticing you had some links to some carnivore friendly docs and this world. Right. What are your thoughts on how we inspire more clinicians to sort of, I've been reported to my state medical board, and I've also been told by the medical school that I teach at that I can't talk about this. And this was from a doctor who had no legs from diabetes amputations. And so,
well, I think part of that, like I said, I think the system is broken. And I think, what we're doing is, we're like, like I said, if you don't like the rules of the game, make your own game or something like that. So sometimes you have to step out there. And a lot of physicians are, they're leaving employed care. They're going into direct primary care, and they're just kind of like, I'm going to do my own thing. And I think patients are going to fall. I think we just have to continue to hold the line, and just even in spite of the fact that we're being chastised and wrist slapped. And some people have to change careers in some cases. It's unfortunate, but I think the answer is not just to sort of concede and just give up, because I think at the end of the day, I talk about, I just put a little funny thing on Instagram. It was like this kid eating these bug soup, and asking mommy, why do I have to keep eating bug soup every day? And he says, well, because your grandfather was a coward. And I think that's where we're at. We're the grandpas, and I'm not I don't know if you're a grandfather. I'm not yet. I got kids, but I'm not a grandpa yet. But at some point I will be, and it'll be on me to do the right thing that's going to affect my kids and my grandchildren, and hopefully, and on and on and on. So, yeah, it's tough, but I think we're starting to make a difference. I clearly we are. If you look at the Google trends, it's showing the carnivore diet has just continues to rise. And, despite all the people saying it's going to go out of fashion, and the reason is because it works. It works, and it works for so many people, and you can't hide that. You can't hide the truth forever. And so I think it's, unfortunately, some of us, and I've taken my share of arrows. I've stood up there and gotten a lot of, rocks and eggs thrown at me, sort of metaphorically, but yeah, I'm still here. And, like I said, it's, there's only so much they can do to you, I suppose.
Well, it's such an inspiration to see so many people in this space. And you're right, carnivore is like keto, and now it's carnivore. But it's really sharing something that's so radically amazing. I've seen too many people have so many medical problems. I suffered, and I've seen them all go away in like 2 to 4 weeks, even though you are still obese. And I say the obesity is not the cause of disease. It's what's in the bowels, which ultimately is mostly fermenting fiber, which is alcohol producing, which is deadly. I say fiber is the deadliest thing we can consume at any dietary habits. And a plant-based diet, which is a low glycemic index, which is deadlier than a high glycemic index, which is radical concepts. But until we beat this thing to bits, because I'm seeing too many healthy people get cancer and infertility and every other disease we know, even though they have the genetic markers, I'm seeing people that go carnivore and everything goes away.
Yeah.
So tell everyone, and really Shawn, Dr. Shawn Baker, just a superstar in the carnivore health and wellness space. Tell us where all of your fans and many other, we keep on sharing, where can they find you?
Yeah. So again, obviously Rivero.com, I'm there every single day, or carnivore.diet. So if you want to directly interact with me on a Zoom call, I'm there every day. My social media is so Instagram. I'm Shawn SHAWN Baker BAKER 1967. I usually put a couple posts up a day. There's some of it's goofy. You know, again, the goofy stuff is just for entertainment purposes only. Don't take it too seriously, but it provides something to get people at least engaged. I'm on Twitter at SBakerMD. I'm on YouTube at Shawn Baker MD. I'm even on TikTok at Shawn Baker MD. And I just wanted to say, because I thought of something that I thought was a good analogy. You talk about keto and then carnivore. I think keto is about the physiology. It's a physiology thing, but carnivore is really about the food. And I think it's right, and ultimately you're right. It's the food, dummy. It's kind of like, it's that. And if it's our gut, our gut is the largest interface we have with the environment. I mean, most of our, immune system is in our gut. This is how we interact with our skin. Keeps stuff out, right? Our skin is designed to keep everything out. Our gut is designed to absorb things. And when we put the wrong things in there, there's a problem, right?
Yeah. It's Occam's razor said the simple answer is the one. And ultimately, the complex scientific studies, I think, are disruptive to true human health and wellness. Faith first, eat one meal a day, maybe a snack, make it as fatty as can be. And if you're not feeling well and what you're eating, feeling well, it's usually what you're eating. And move every single day. That's critical. And if you're doing it with others in one way or another, community, which makes our lives much, much better. So again, to Dr. Shawn Baker, find him on Revero Health, and we'll throw some links out there also to all his really amazing stuff. So thank you to everyone for joining us today. I know we didn't answer all your questions, but I'm going to be on 10 o'clock 10 o'clock a.m. on Sunday, every Sunday, 10 a.m. Eastern time. I'm doing it live. It's fertility, but it's fertile health for everyone. So God bless, and thanks so much for joining us, Dr. Baker. We really appreciate you.
Hey, my pleasure. Thanks for the opportunity. Thanks, Dr.
Awesome.